The propagation of electrical stimulus from one cell to another produces an electrical impulse that can be detected by skin electrodes and recorded on graph paper as an electrocardiogram, or ECG. It is important to note that the ECG represents electrical activity only, not the mechanical activity of the heart. The cycles of depolarization and repolarization consists of 5 phases, 0 to 4. The action potential is represented by a curve showing voltage changes throughout the 5 phases. During phase 0, a cell receives an impulse from an adjacent cell and is depolarized. During phase 1, early rapid repolarization occurs. Phase 2 is a plateau phase of slow repolarization. During phase 3, rapid repolarization of the cell occurs as the cell returns to its original resting state. During phase 1 and 2 and the beginning of phase 3, the cardiac cell is in its absolute refractory period. During the last part of phase 3, the cell is in a relative refractory period as a strong stimulus can depolarize it. Phase 4 is the resting phase of the action, where the inside of the cell is negative and the cell may respond to another stimulus. Depolarization of one cardiac cell acts as a stimulus to adjacent cells, spreading outwards and causing them to depolarize. The heart has an electrical system that generates and conducts electrical impulses rapidly along specialized conduction pathways from the atria through the ventricles. As previously mentioned, the heart has electrical cells with the property of automaticity. The sinoatrial, or SA node, which is located in the wall of the right atrium near the inlet of the superior vena cava, is composed of cells that have the highest degree of automaticity and normally discharge impulses faster than any other cells in the heart. The SA node normally generates impulses at a rate of 60 to 100 times a minute in adults. Therefore, the SA node acts as the predominant natural pacemaker for the heart. The electrical impulses travel down Bachmann's bundle and internodal pathways to the atrioventricular, or AV node. The AV node is located in the posterior floor of the right atrium. The AV node contains cells that can also be pacemakers and can generate impulses at a rate of 40 to 60 times a minute. There is slower conduction through the AV node, and this longer conduction time allows the atria to contract and to fully eject their blood into the ventricles. This in turn allows the cardiac chamber to fill more completely. This stretches the muscular wall and produces the most efficient ventricular contraction, or systole. From the AV node, the impulse travels down the bundle of His in the intraventricular septum into both the right and left bundle branches, and then finally through the Purkinje fibers to the ventricular muscle tissue itself. The Purkinje fibers are able to generate impulses at a rate of 20 to 40 times per minute. Once the electrical impulse travels down the conduction pathways, the left and right ventricles contract nearly simultaneously. Any myocardial cell in the atria, AV node, or ventricles has the capability of taking over the role of pacemaker. For example, if there were interruptions in automaticity and the SA node failed to initiate an impulse at 60 to 100 beats per minute, the AV node would take over and impulses would be generated in the 40 to 60 beat per minute range. If both SA and AV node fail to initiate an impulse, The Purkinje fibers could take over and initiate impulses at a rate of 20 to 40 beats per minute.